Toledo-Lucas County Health Dept identified the first presumptive case of COVID-19 in Lucas County. We have health and medical professionals here today to talk about that case and answer any questions you have about it. What I wanted to emphasize is that this is something that we expected. This is to be expected, and to be frank, we expect that there will be more cases like this in the upcoming weeks. That is why it was so important for us to prepare ahead of time to be able to handle the cases that will begin to be seen in our community. So we're continuing to take the steps necessary to make sure our community is prepared. We have developed a plan. We've been working on a plan for several weeks, frankly. We have intensified that work in the last week, and now we are ready to execute our plan. So this is something to be taken seriously, but nothing to be surprised about. We knew this was coming, and we know there will be others. And because we have been working as hard as we have, we will be prepared for this moment. With that, I'd like to turn it over to Tina Wozniak, the President of the Lucas County Commissioners, for some remarks, and then we'll hear from our health professionals.
Thank you, Mayor. Good morning, everyone. We have been being prepared for this very moment. We're asking everyone to remember the key components, which are to prepare and to take the steps available to you to help both yourself and your loved ones use those skills that you have learned about, such as hand washing and all the other important pieces of social distancing to be prepared as we move forward. The steps we take today will be so valuable as we prevent those cases we may learn about today or tomorrow or the weeks ahead. We're going to hear from our health professionals now, which is really, really the key reason that we meet again today. I want everyone to rest assured that the city and the county are continuing to value and plan to have a coordinated effort around this coronavirus for our region. We are working around the clock and will continue to do everything we can to have a healthy community. Thank you. I'm going to turn it over to Eric Jagodzinski, our director of our health department, and the other health professionals that will tell you about the current situation in our area. Thank you.
Thank you, Commissioner. My name is Eric Hinske. I am the Health Commissioner for the Toledo-Lucas County Health Department. I think before we get started really getting into the issues at hand, I really want to make sure that the community understands that we still are looking to make sure our hands are washed, our hands are washed, our hands are washed for 20 seconds or more with soapy water. If that's unavailable, please use that hand sanitizer, but make sure you're washing your hands. Avoid touching your eyes, your nose, your mouth with unwashed hands. That's important. Avoid contact with sick people. This is really going to be important here in the near future now that we know that we have the case. Stay home while you're sick, except to visit a healthcare professional. Avoid close contact with others. Or if you have to venture out to go to the grocery store and things of that nature, yes, that is acceptable. Please do that. Cover your mouth and your nose with a tissue or your sleeve, as we've been talking about for so long now, to cough or sneeze into. This is really important too. Please get adequate sleep and eat well-balanced meals to ensure a healthy immune system. Again, we've talked about that a number of times, but these are all things that we want to come back to make sure our community is doing. I want to talk a little bit about that social distancing again. We are looking for that 6-foot separation. So if you're washing your hands and you have that 6-foot separation, you're less likely to come down with coronavirus. We are confirming today, as we've been saying, that Lucas County has had a positive case, their first positive case of COVID-19. To the best of our knowledge, it right now is an international travel-related case. Please, 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 as I just stated, it is the first case and we are expecting more. It won't be the last. This individual is a man in his 70s who's traveled to Europe at the end of February and is unstable in the hospital. The individual has limited contact with the community upon return from his travels. The reason we know this information is because of the investigation process that we go through, and it is extensive and relatively complex. But I'm going to introduce Lauren Wagner, our epidemiologist at the health department, to kind of boil this down so the community can understand what we need to go through to actually follow up on any of these cases that we're going to come in contact with in the future. Lauren Wagner?
Thank you, Eric. Hi, I'm Lauren Wagner. I'm an epidemiologist for the Toledo-Lucas County Health Department. I would like to take a minute to walk you through the COVID-19 case process. I'm going to refer to this chart here on my left. So what do? Let's start with, do you meet criteria? If you have symptoms including fever, dry cough, or shortness of breath following contact with a confirmed COVID-19 patient, if you have symptoms including fever, dry cough, or shortness of breath following international travel to an infected area. If yes, please call the 24/7 nurse hotline. Those numbers can be seen here on the podium. If those next steps include testing, you will get tested. It will be sent to a lab, and your results will be delivered to you. If those are positive results, we will begin contact investigation. The local health department does this contact investigation to identify potential spread in our community. Depending on an individual's level of exposure, they will be placed in the following risk categories: high and medium risk. These people had the most contact with the infected individual. They should self-quarantine for 14 days. Low risk. These people had minimal contact with the infected individual. They should monitor their symptoms for 14 days. I would like to now introduce the Toledo-Lucas County Health Department's physician liaison, Dr. Jay Smith. Thank you.
Good morning, everyone. As Lauren said, my name is Dr. Jay Smith, and I'm a physician liaison for the Toledo-Lucas County Health Department. A couple things I want everyone to keep in mind this morning. First off, the time between exposure to the COVID-19 virus and symptoms can last anywhere from 2 to 14 days. We are advising the community to stay home and only go out for essential necessities at this time. COVID-19 symptoms include a fever, and that's a temperature greater than 100.4 degrees Fahrenheit, shortness of breath, and a dry cough. To be safe, we are asking exposed people to stay away from others for 14 days. This is particularly important for our vulnerable population. Vulnerable populations are those that are 60 and older with underlying conditions such as lung disease, diabetes, or heart disease. For these patients are at a greater risk to acquire the disease and should be overly cautious at this time. Why we ask everyone for an elevated level of concern is that even if you may not be experiencing any signs or symptoms of COVID-19, you are still at risk for infecting those you may come in contact with, including your loved ones and your community. If you think you may have symptoms, please contact the Lucas County Community COVID-19 call-in numbers, which again are listed on the front of this podium. I'm going to hand the podium back to Eric for our wrap-up.
Thank you, Doctor. I really want to make some closing remarks here. I want to go back to the gatherings. Please, those non-essential gatherings, we would really like you to limit those. It's really important for the health and well-being of this community and for our healthcare system to be able to actually handle this crisis over the next several weeks. So again, please limit those gatherings as much as possible. I really think that what we need to do is take a deep breath and understand that we're going to get through this. We need to take care of ourselves and one another. That is so extremely important. As you can see, we're working as a team. Elected officials, first responders, hospitals, the media. Everybody's working together to make sure that we get through this process and actually come on the other side better than we were today. Today's press conference is a special situation, please. I want you to understand that because this is our first case, We decided that we need to release this and talk to you as early as we possibly could. We had to do some things behind the scenes with the epidemiologist and other individuals. But going forward, Lucas County's new cases will be included in the governor's 2 o'clock daily update. The reason for this is because we want to make sure that we have the accurate statewide information. But again, because this was the first, we wanted to make sure that we got it out to you as soon as we could. But from now on, please, we're going to follow what the state is doing relative to releasing the numbers because we don't want to be inaccurate about what we're telling you. So again, locally, we'll be available at the Media Joint Information Center daily at 4 to answer any questions. And please, please, please stay abreast, if you would, on some of those press releases, because if we really don't have anything, we don't want to waste any valuable time coming together and not having an update for you. But again, we will give you as much information as possible. You need to know, please, we are working hard behind the scenes and that we are going to respond accurately, quickly, and appropriately for any of these issues. We will also be able to hopefully announce here soon some additional testing availabilities. So please pay attention to the media and to the experts who are going to be coming forth and talking about that here soon. So with that said, I'd like to open that for questions.
When did this individual return from Europe and when was he tested?
Lauren?
As we stated, the individual returned at the end of February and was tested in the time frame in which the individual's symptoms started.
And where was he tested at? Was it a specific hospital? Was it a lab? Or was it?
The individual was tested at a hospital facility.
Do we have the name of that hospital?
In order to protect the individual, the hospital facility isn't named.
Thanks.
Thank you.
What else? Yes, please.
Do we have an approximate number of tests that have been given out in Lucas County?
You know, right now, I think I heard this morning we're working on 3 additional tests. There's been a number of tests, but of course we know that that testing is very structured, as Lauren just kind of said. So we don't have the test I think we'd like to have, but again, we're testing as many people as needed.
The Cleveland Clinic has developed some testing. Is
Mhm.
there any developments that are here locally that would potentially have some testing at a hospital?
Again, we're looking at every possibility for testing. If you've heard the recent news about some other labs that are coming online, Roche and some of those other ones, we're going to be able to have additional testing here real soon.
Will the people that were in contact with that person, will they be notified?
Again, that's what Lauren does. That's what we do every day when we have disease outbreaks. Nothing quite like what we're going to have here in the future, but we're going to be able to contact individuals as we get those contacts from the family or whoever else we might be able to talk to.
How long does the testing that you guys are performing or the state performing take?
You know, we're looking at 72-hour return time. Again, don't want to get too much in the details, but if we look at a 72-hour turnaround time, I think we're okay.
Is there a number as far as total tests here in Lucas County?
I don't have that at the top of my head, so we can get that for you.
Do we know if this individual has been in contact with those? I know he's an elderly man.
Mhm.
Yes, does he have family?
Yeah.
Contact with?
I'll give you a little bit of background. Again, I don't want to get too much into HIPAA, things of that nature. He does have a significant other, and so we know that. So now what we're doing is Lauren and the team back at the health department is looking to see who else they might be in contact with. This individual was a 71-year-old, so we know some things that we're going to work from to make sure that we can follow up and the community is as best protected as possible.
So I understand that you guys have kind of been preparing for this to happen. How quickly do you expect this to expand? I know that we're trying to
Mhm.
expand, lessen everything.
Yeah.
How quickly do you expect to see more cases?
More cases? People keep on asking me that. I wish I had that crystal ball where I can see, next week we're going to have X or next week we're going to have X. It's just really hard. I mean, this is a travel, as we can find out right now, it's a travel, figure that out. So it's not community spread, but what's going to happen in the near future, we really can't tell. All I can tell you is we will have cases. What that number will be dependent on what we do as a community. That's social distancing, the washing hands, not going out to parties and things of that nature unless we absolutely have to. So again, that's really important.
Do things change when it becomes community spread, I
I think they change for our psyche. I think that's what it is. Right now, we're operating the same way as we would with community spread. We're going to follow up. We're going to do the things. Again, I want to stress, the number of cases will depend on us in this community and in this state. And you heard that from the governor. You heard that from Amy Acton, marvelous individual, who is really trying to tell us you need to do these things so we don't have those increased cases. The less cases we have, the less sick people we have in our community, the less death we have of those individuals, immunocompromised. But I want to stress this, and I don't think we as younger or older individuals understand, when we stress our healthcare system, that means we can't respond to heart attacks, car crashes, things of that nature. We use up those resources. This is what we're trying to stop. We want to make sure that we can respond to, your dad or your mom having a traumatic issue, having a heart attack, being able to get in and be seen and be saved. That's what we're trying to stress here. So again, we don't want to stress out the healthcare system by having a lot of COVID patients.
Are there any plans to send individuals who do test positive to like a specific hospital?
That's a great. I really was hoping that we would have the plan finalized, but the community needs to know we are working tirelessly to figure out logistical issues, other things to get more tests done on people here in the community in a safe manner. You got to remember, we don't want sick people going to the hospital unless they absolutely have to. So if we can keep them out of that hospital setting, we can keep them from infecting nurses and doctors and those individuals who are going to take care of us. So that's what we're trying to figure out. How do we keep individuals that we need to have tested out of that hospital setting? So more to come on that. I'm hoping within the next day we can announce something.
You mean, Lisa, that that's being discussed?
Oh, it's not just being discussed, it's being finalized. We just have to be able to do some things to make sure that it's when you're planning for these things, you really have to get into the details, and that's where we're at right now.
We have time for about 2 more questions, if anyone else has anything.
I have two for the mayor. There's talk about Tuesday and voting. Has there been any changes or thought?
There's been discussion about it, but 3 times in the last 4 days, the governor has reemphasized that the election is happening and can happen under the parameters of how many things in our life will happen going forward. Responsible, reasonable things that can be done with common sense cautions being applied. So what do I mean? I voted yesterday. There will be early voting today. The election will take place on Tuesday. Be smart. There's hand sanitizer in there. There was some social spacing as people waited in the lines. Try to vote early today if you can, or tomorrow. Is there early voting tomorrow? Today and tomorrow. And if you don't vote until Tuesday, maybe select a time of day where the traffic isn't likely to be as high. So yes, the election is happening, but I think this is an opportunity for a larger point. There are going to be things that we have to do, should do, ought to do, that we're going to have to continue doing over these next weeks, maybe months. We can't stop living our lives, and voting is a core part of being an American. That's something we should do. The point is we're going to have to be doing these things differently, and we're just going to have to take precautions, and I can tell you, having seen it yesterday, there are some precautions in there, and we'll move forward. So yes, the election's happening, but on a larger level, we have to live our lives, and we have to continue to live our lives. We just have to do it with an abundance of caution and just understand that we're entering a different period here for the next couple weeks, and we can get through it, and we will. So yes, please vote Tuesday. I would argue that given what is happening right now, it's more important than ever to vote. It's a reminder of who we are as a people. And it's the sort of thing we can do. We just have to do it, with a little bit of an eye toward caution.
There's been some pictures sent to our newsroom of price gouging. Any reports to your office of price gouging?
None specifically yet, though I can say we are setting up systems within our office to make sure that businesses have the most updated information on how to deal with what's happening here. We have a conference call tomorrow at 3 o'clock, for instance, with primarily restaurant owners, but other small businesses talking through accommodations we can help them make, I think there is a likelihood that there will be emergency funds released either by the state or federal government to make up for some of the hardships they will face. We're going to talk our way through that. I think you can anticipate an announcement tomorrow about some of the things that we are doing to make sure that children whose only nutritious meal typically would happen at school and now for the next several weeks won't have access to that meal. I think you're going to see an announcement at the United Way about things that we are doing to, to make sure that those basic needs are met. So, the work of government continues, the work of society continues. We know that there's not just an aspect for all of us as citizens, but unique needs that children, seniors, businesses may have, and we are working through that. I have I'll be on the phone today with the governor again at 1 o'clock, and we are in pretty constant contact, and we're working together. And again, this is something that will require some sacrifices for all of us over the next several weeks and maybe months, but that's okay. We can get through this. We've been, not often, but we've been down this road as a community before, and we will come out on the other side stronger. We expected to be where we are. We know there will be more cases like this, and we just have to keep our head about us and be smart and get through it, and we will.
You mentioned the governor, and he was on a national talk show saying that schools could be closed for a year. Have you had any conversations with him about that?
I anticipate that'll be part of what he updates us on at 1 o'clock. I think the information that he has provided us indicates that this is something that the reality we have entered into is a reality that will be with us for the next several weeks, maybe even months, 2 months or so. I don't think anyone knows, but I think the expectation is that this is something that could be an 8-week thing, maybe 10 weeks. Simple math will tell you that starts pushing us to the end of the school year. We're gonna take this a day at a time and react to information as it comes, but we'll be ready. We'll be ready. All right, thank you.
Thanks, everyone.
Thank you, everybody. Appreciate it.